Let's now talk about Medicare prescription drug coverage levels. The initial coverage level for Medicare for the year 2011 is that you pay your deductible, if any, plus the copays for your prescription drug plan. For the first $2,840 in actual cost of medications. So that means what you pay in copay plus the portion that the insurance company covers. When those added together reach $2,840 or retail cost of drugs that you have purchased, then you would enter into the second phase of coverage, which many of you have heard of but not really understood, which is called the coverage gap or donut hole. The good news is that most of you will never reach the donut hole, and so it will not be an issue. But for those of you who might, we do want you to understand it and to know that even better news is that the donut hole has begun to shrink based on recent legislation and changes in Medicare. In 2011, if you reach the donut hole, you will receive a 50% discount on name brand drugs, and that is sponsored by the pharmaceutical companies themselves. Then Medicare will subsidize 7% of the cost of generic drugs, so you pay only 93% during that coverage gap. That gap lasts until your true out-of-pocket costs reach $4,550. At that point, you would enter into the third phase of coverage, which is called catastrophic coverage. At that point, you get a great relief from Medicare in that you would have very reduced copays for the rest of the plan year. Those would be $2.50 for generic drugs, $6.30 for brand name drugs, or 5% of the actual retail cost of the drug, whichever is greater. At that point, you would stay with those lower copays until the end of the year, when that would reset and it would begin again. But also the donut hole will continue to shrink over the next several years based on a schedule that has come from the recent legislation. We want to talk now about post-enrollment customer service. As we assist you to enroll at Extend Health in new coverage, that's not the end of our responsibility and relationship with the retirees from Houghton Mifflin Harcourt. We will continue to be here just a toll-free call away for advocacy and support services. You can call to an Extend Health representative, and we're here to assist you with claims issues, appeals, network questions, and questions about health reimbursement accounts, whatever it is that is something you need assistance with. Also, you may want to change plans. And the renewal process, certainly under Medicare, you have the ability to pick new coverage for future years. You're not locked into this year's coverage choice. And then we certainly will offer ongoing enrollment services as retirees or spouses of retirees turn age 65 and become Medicare eligible. At that time, we will reach out to those people and assist them with making the same change from the group plan of HMH over to individual Medicare. Now, what are the next steps? For you, the next step is to review the Getting Started guide that you've already received in the mail. Secondly, gather up your Medicare card, the prescriptions that you take on an ongoing basis, and your doctor information. All we need there is the doctor's name and telephone number of those doctors that you see on a regular basis. Lastly, then, pick up the phone and call to us. call Extend Health at 888-636-5749. That call will be directed to a benefit advisor that is ready to assist you, and they are licensed in the state where you live. We will be reaching out to you as well if you don't call us, because our dedication to Houghton Mifflin is that we will not let anyone fall through the cracks. So we urge you to pick up the phone and call us, but also if you receive a call from us, please welcome that benefit advisor and know that they're there to assist you with that transition in the simplest way that they can. Now, questions and answers. I know that you all have numerous questions, and the best way to take care of that is to pick up the phone, call us today at Extend Health, and we're ready, anxious, and willing to assist you with those questions as we go through this transition together of your change in health care coverage from group plan under Houghton Mifflin to a private Medicare plan. Thank you so much.